Hi, so this is my name is Constantine. I'm from the MacCallum Cancer Centre, and I'm here to talk about the novel agents under investigation for relapsed refractory CLL at ASCO 2021. So to start with, this is a world where we've got a number of mature agents in CLL now, which are all very active. These are BTK inhibitors and BCL2 inhibitors. And at ASCO this year, we have got a number of new agents which have been presented, which are new representatives of this class. So in particular, there is a drug called TG1701, which is a new BTK inhibitor. It looks very similar to ibrutinib, acalabrutinib, and zanubrutinib in that they are all irreversible BTK inhibitors. But this drug is by TG Therapeutics, most definitely has activity. And what's exciting about this drug is that it has been combined now with the TG PI3 kinase inhibitor, as well as the anti-CD20 in a triple combination. And they've shown that in this combination of U2 plus TG1701, that they had a high activity and good tolerance, especially in indolent lymphomas where they had complete remissions. Along a similar vein, there is a new BCL2 inhibitor, which is similar to venetoclax. This drug is called APG2575, otherwise known as lisaftoclax. And this is a drug that has a shorter half-life than venetoclax, which allows them to do a faster ramp-up schedule. And once again, the phase 1 data was presented, showing that the drug seems to be acting just as you would expect for venetoclax, i.e. active in CLL with a response rate of 12 out of 15 patients. So these are new drugs in existing classes that have been proven to work. It's always good to get more options in our existing classes of drugs. But probably the most interesting abstract to come out from ASCO this year in relapsed refractory CLL is the Elevate RR study, which is a study that compares head-to-head ibrutinib versus acalabrutinib in patients with relapsed refractory CLL. So this is a study of high-risk patients. They are all relapsed refractory. They all carry either 11q or 17p deletion. And this study enrolled over 500 of these patients and randomized them head-to-head between acalabrutinib and ibrutinib. And what they found was that the progression-free survival and overall survival were equivalent between the two classes of drug, which is great. It's a non-inferiority study. But what is really interesting is that acalabrutinib was really confirmed to be much better tolerated than ibrutinib, with a reduced rate of atrial fibrillation, a reduced rate of hypertension, arthralgia, diarrhea, as well as a reduced rate of bleeding. So this is the second head-to-head study of a BTK inhibitor against ibrutinib. The first being, of course, the Aspen study in Waldenström's macroglobulinemia comparing ibrutinib and zanubrutinib, where basically the same thing was found, that the more specific BTK inhibitors were able to have less atrial fibrillation, less hypertension, and less bleeding and arthralgia. So I think we're starting to enter into a world where the second generation BTKIs are really proven to be better tolerated than ibrutinib. So far, the efficacy data for both the first and second generation remains very good. And it's exciting to see new drug options come along for patients with relapsed and refractory CLL. Thank you.